much are we going to be paid? Some 2 years back, the president of Uganda issued a directive that all interns should be paid half of a substantive cadre, of what a substantive cadre earns. So we want to know whether the ministry is going to implement that directive or it is not going to implement it, and what's the way forward. We are also interested in knowing whether our accommodation is available for most of our interns, and in areas where it's not available, what's the ministry going to do about it? We're also interested in knowing about, there are some interns, the female interns sometimes get pregnant during the course of training. Would they hold their internship? How will they handle that? We are also interested in knowing more about the policy, the internship policy. How far has government gone with the medical internship policy? To check from here as well, we are also interested in knowing about, we have what called major disciplines and minor disciplines, and it seems the hospitals have been dictating what you do. But we would love to know, are we given a chance to choose whether I'm going to do surgery or I'm going to do obstetrics, something like that. So basically, those are the major concerns of the majority.
1 million that has now stayed stagnant. What do you make of it, that allowance?
That allowance is it's not sufficient. It can't ably run a medical intern for a full 1 month. He's going to rent a house, he's going to pay transport, he's going to pay many bills, he's going to work about 36 hours shift. I feel it is inadequate, and my recommendation and what we shall strive for when we officially get there is to advocate and to ensure that this can be stepped up to an amount which is reasonable according to the presidential.
Okay. Good afternoon, viewers, and thank you for that question. The president, it is true, directed that we pay 2.5 per intern sometime back when the numbers, were manageable. But because we operate a budget that has not grown, we discussed and agreed that for purposes of equity, given that the numbers had grown, we accommodate many numbers of interns and reduce the facilitation to 1 million to be able to accommodate quite a number. And that's the decision. From the time when that decision was made up to today, the budget has not grown substantially or significantly to be able to accommodate the area directive given of 2.5. So we continue to pay 1.5, rather 1 million even this time around, because we are dealing with over 2,500 interns. So the budget is the limiting factor that is limiting us as an institution from paying the area directive of 2.5 million per intern.
What's the budget this time around?
It's about 35 billion, yes, for all the interns.
What potential long-term effects could this reduction have on healthcare system and training of the future doctors?
Well, we don't seem to see the negative impact. I think the call is for the interns to understand and appreciate the economy in which we operate and the challenges that we are dealing with. Because this is part of training. The government came in to give facilitation, to mitigate, to cover some costs for interns. So we expect the interns to understand the situation that we are dealing with and to take it in good faith, and train, and qualify and come to serve their own country. So we don't envisage a lot of negative, impact arising out of that. Thank you.
This meeting is intended to transform medical doctors, nurses, midwives, and pharmacists who have been going through 5 or 4 years of training. So they are theoretically competent, examined by their various institutions, they have passed. But in this country, before you are given the authority to treat people, you must go through intense training of internship where you can now be allowed to treat people independently. So it is a part of the training process. So in internship, we are giving a transition period where the doctors who have qualified will be practicing under supervision, under observation, and it is continuous learning for them, so that now they're able to process patients' complaints into a disease product which can be treated. So this requires a tact. It requires tact in eliciting the responses. Those questions which doctors ask are not random. They will perfect the art of questioning patients in order to respond appropriately and synthesize these responses into a disease process, examine them, call upon the right investigations to be done, make the prescription, so we are going to be training them to do this now on hundreds and hundreds of patients, so that after 1 year, you can now allow them to go and treat the public on their own. So it is more intense than where they have been, and this is the purpose of this meeting. Now, for this to happen, we are making them appreciate what it takes to be a doctor, what difficult choices you are supposed to make, and what guides you in those choices you make is the ethical code of conduct. So they might have been taught these in their universities, but today we have brought people who have been in the field to tell them patients have rights. You as a healthcare professional, you have responsibility. You must balance. It's about balancing, doing no harm, doing the right thing to the patients, and know how to behave in the care setting. So this is what this meeting is all about.
Call for this cohort. There are several ways through which issues can be discussed. We don't want a situation where it appears like every conflict or every issue you have must be dealt with in a radical manner. So we have advised them that once they detect a challenge at their workspace or where they are training from, those issues can be raised through the leaders who supervise them and handled in a civil manner. So we wouldn't encourage civil outright we call it civil disobedience. How do you call it? Those radical approaches of placards on the street. It is not called for. That should be the last resort, in my view. Thank you.
How many are they that you're taking this year?
I don't have the numbers off cuff, but it is above 2,000. So I think about 2,000, 2,300, 2,400, around there.
Luganda.
But I don't have the numbers off cuff.
Luganda.